COVID-19 has changed our lives drastically in ways we could never have anticipated. Many feel helpless, and others wonder what to help the staff and patients at Kingston General, Hotel Do, and Providence Care. Last week, KHSC and Providence Care put out a request for public donations of disposable gloves, hand sanitizer, soap, and other cleaning supplies in anticipation of a shortage. Joining me today to talk about why these donations are needed is Tom Zulne. Tom, how are things going for you guys?
Well, if you meet at the hospital or at the foundation, on the foundation side, we're like everyone else, we are practicing our physical distancing and social isolation as much as possible. Most of our staff are working from home if they can. We have a few that are here on site, especially those that are processing checks and those kinds of things, because that can't be done from away. At the hospital, of course, there's been full planning mode over there and getting ready for the worst that could come, so that they'd rather find out that they've overplanned than to be caught in trouble. So in that sense, things I think there are going quite well. The number of patients have been reduced, so there's lots of hospital beds available and so on. Providence Care is also working on increasing their bed capacity so they can take any overflow from Kingston Health Sciences Center. So things are going pretty well that way. Of course, there's some anxiety among some of the staff, but the things are being managed well in terms of our infection control people and issuing guidance to ensure that all of our healthcare workers are well protected.
Tom, I keep hearing that frontline workers in hospital need supplies. Is that the case in Kingston?
So I think Kingston is probably a little bit better off than a lot of other places, but it will become a problem if we don't all practice what we're supposed to be doing and there's a surge. So thirdly, there is supply. The hospitals are doing their darndest to manage that supply so that it doesn't get used frivolously. So they're being used in a much more sort of careful way than might have been used in the past. Not because it's less safe this way, but simply that, for example, instead of visiting one patient at a time and changing out the gear, they're being encouraged to sort of visit 4 in a row so that they don't have to change between them. These kinds of things have been put in place. So there is certainly some capacity there. There are some pandemic supplies as well. And we have been getting lots of donations from the community. The issue for PPE, as it's called, the personal protection equipment, is not one of cash per se. It's more of supply. As you can imagine, there's a high demand for this across the entire planet, and the producers are just not capable of keeping up, and that's why the hospitals have put out a call to collect this so that should they need it, they'll have it.
Now, I don't have the stuff in my house, but other businesses have this. Who do you think should be hearing this and saying, hey, I got some of these things, I can donate them?
It seems to be coming from everywhere. And so, we've had things like an individual who has a workshop that happened to have a sealed mask somewhere in the toolbox and has brought that in, right through businesses that have actually made special orders to their suppliers to get their hands on things like gloves, for example, that are often used by a number of different businesses. There are also some others that are in the sort of caring professions, such as chiropractors and dentists, who perhaps aren't seeing as many patients now as they might have been in the past, and therefore can spare some of their equipment. So it's coming from all kinds of different places. There are also labs around that are perhaps closed down because of the pandemic, and so they have supplies, and those are coming around as well.
Now, you also have patients who may be there for a very long time. What sort of things do they need?
Right. So one of the other calls that we've got out is for just cold hard cash, and in 2 areas. One would be a comfort fund, and that fund would be for patients or for healthcare workers. On the patient sides, for example, the Kingston Health Sciences Center has already made a purchase of things like iPads and phone chargers, because of course there's restrictions on visitation. So the patients don't get bored, they're looking for things to keep them occupied. And so an iPad could be a way for them to connect with their family members who can't make it into the hospital to visit. They may have arrived without their phone charger, so now they've got one to keep that juiced up. Puzzles and books, those kinds of things, of course, are also being purchased for patients. And on the staff side, it's more around things like coffee and snacks and those kind of things to recognize the fact that some staff are working extra hours.
Now there's people out there who would love to make you a big batch of chocolate chip cookies, but
Mhm.
can they do that and somehow get them to you?
No, so one of the challenges that the hospitals are facing is, of course, they're trying to restrict access and minimize the number of deliveries that are being made on site. And so they would prefer not to receive those kinds of things because they can't get them to the patients. So making a donation of cash through this fund is actually a better way to go. There's even been some operators in town, such as pizza joints and coffee and those kinds that have offered. And for now, we're saying that if they want to make some kind of contribution, gift cards would probably be more useful as a way of recognizing staff than to actually deliver the coffee. The catering services in the hospital are working just fine. So therefore, the hospital is able to get their own services to provide these things. And as you know, there are various franchise options on the hospital grounds as well. So those things are all still operating for patients and staff.
Okay, so the franchises that are on the hospital grounds, they'd probably be the best bet.
Correct.
So gift cards for those.
Right.
So they are
Well,
Tim Hortons or
the,
who do you,
in
what
terms of
franchises?
yeah, so there have been some franchises on outside of the hospital that have offered to bring food in. So that is what we would prefer not happen. And those franchises have been asked that if they want to do something, that providing us with gift cards would probably be better, so that staff on their way home potentially could go and pick up. So it's not that we're asking the public to send us cash cards. It would be better if they just sent cash, because that would be a lot easier for the hospital to manage to get what is really the priority to the patients and the staff when they actually need it. The other area that we need support in is just general unrestricted money so that the hospitals can react quickly to purchase equipment to help with either diagnosis or with treatment of patients. And although there's been an announcement by government that they will cover all pandemic related costs, there's been no official word as to what that really means. And so there are instances where the hospitals are going out on a limb purchasing things that perhaps were planned to be purchased at a future time, but are being purchased now to make sure that they're ready. And those kinds of things, they really don't know what that's going to be covered or not. And we don't want the hospitals to be thinking, well, will we get reimbursed for this or not? So having that kind of liquidity certainly makes that easier.
I understand. So
Hmm.
where can they make this donation? They can do it online.
Right. So the easiest would be to go online to uhkf.ca/donate. So that's University Hospitals Kingston Foundation, and we will direct it to the two hospitals. The other would be to mail it in at 55 Rideau Street in Kingston, of course, and the postal code is K7K2Z8. Or you can phone it in at 613-549-5452. And so that's how cash donations could be made.
And for the other things, the if someone has gloves,
Right.
someone has a respirator, someone has some cleaning supplies, how can they get those to you? Where's the drop
Sure.
off for those?
So the best thing to do there is to phone an organization called Shared Supplies Southeastern Ontario, or 3SO. That is the organization that looks after supplying all the regional hospitals. So not just the ones in Kingston, but also those out in Brockville, Napanee, Belleville, Perth, etc. And there's a email contact to get a hold of, and that's a Marianne Takala. So Marianne, MARYANNE .Takala, TAKALA at 3so.ca, and she will confirm whether the supplies people have are in fact the kind of supplies that they're collecting, and then they will tell them where to drop it off. And it's partly dependent on where it's going to be dropped off. We've had one business, for example, who is planning on delivering 10,000 masks, so it's always going to go to a warehouse, not just be dropped off on a street corner somewhere.
All right. Well, a good system in place, and I
Mm.
know I speak for every resident in Kingston, and when I say we are so glad you're there, that
Thank you.
that you and the whole team are doing what you do. Thank you so much.
Well, I'm very proud to be associated with the hospitals in Kingston. I've been really impressed with the level at which they've been planning for this since January, as soon as news broke from China. So we're really in a good position within the region and in the country, for that matter, compared to some of our neighbors.
Stay safe.
You too.
Thank
Thank
you.
you.
Bye-bye.
So long.